My name is Kate Namacher. I am the Vice President of Education here at NHF, and I am joined by Lena Voland, our Director of Education, who will be helping with all things tech and Mentimeter, but just will chime in whenever needed as well. So great to see so many folks on here tonight. As we, I don't know, Lena, are you able to pull up this? There we go. Thank you. So that's me. But really, this is about what we're here to do together tonight. So you're here at Knowing the Players, Being a Savvy Consumer session. So we truly welcome you all. Go ahead to the next slide, please. All right, as always, we always like to touch on our mission at NHF, as we're very much driven by the work we do and keeping, patient-centric focus on our mission. So tonight, while we do many things here as we list, we're really focused on the education to enable people and families to thrive. And a piece of this is really, who are all the players in our community? That was spoken about a little bit last week, but really tying that together for this week and understanding how can I be a savvy, conscientious, patient, family member in the community to navigate through all of this. So with that, next slide. So just to get us warmed up here this evening, for those, I see some familiar names from last week, but for those who are new, welcome, welcome. We do a little icebreaker to see where everybody is from. We are actually going to be using another technology besides Zoom tonight. So you can go to menti.com. You can see it up there at the top, and Lena has been throwing that all into the chat as well. And you can type in code 808. That's a long code, 44124. And then what's really cool is you can just place, your actual little cursor. It'll have a little dot, and you can place it on where you are joining us from tonight. And we do apologize. This is obviously very United States centric, but if you are joining from another country, we welcome you, or another portion of the world, we truly welcome you. So go ahead. You can pull it up on a phone if you want. Sometimes I just use my cell phone. You can actually pull it up on another browser if that's easier for you, or if you're actually on a laptop. We invite you to join us. All right, let's see. Oh, I see some hearts. But folks, is anybody having problems actually clicking on it?
Yeah, Kate, so I'm clicking on it on my phone to play along here, and for some reason it's not really letting me. So maybe we can have people chime in the chat where they're from.
Love that. Absolutely. And I, for one, am doing this call this evening from the Lower East Side of Manhattan in New York City. So I'm going to apologize in advance if you hear the cars honking outside my window. Oh good, we have Hawaii, and it looks like we have California. Welcome, welcome. Okay. Oh, Arkansas, great. Welcome back. Yes, a couple folks, Chicago, that we had on last week. Great to see these names again. Wonderful. Oh, Kansas City, great. All right, and as people are chiming in there, the other thing that we are asking of everyone tonight, if you can go ahead and rename yourself. So if you are here as a patient, family member, chapter leader, so that type of community member, you are welcome to either keep your whole name, or you can just put your first name and last initial. If you are one of our wonderful industry partners who might be on, we invite you also just keep your name on, but share the company that you're with, or you can say industry partner. And both Lena and I have NHF at the end of our names, just so we can see who's here and joining us this evening. Plus, we might have some fun raffle prizes at the end for those who stick around to the end. We do a little raffle for our community members and consumers who are on. Great. Welcome, welcome, everyone. All right. Well, why don't we continue on? We have some additional questions in Mentimeter, so we're just going to keep going with it, and let's hope that this works for the rest of our questions tonight. If not, we will be very active in our chat. So part of the title was being a savvy consumer. So what does that mean? You know, you may have heard that word before, being savvy. For NHF, we know that we have a lot of choices as community members and a lot of partners that are out there. Last week on the session, that if you weren't able to make it on, all about, you know, really understanding the different players that are in the community, all those acronyms, HTCs, HRSA, what are some of the other ones that were thrown out there last week? There were so many, all of our chapters, so many different types of players, industry sponsors, specialty pharmacy, all of that. So it's really, you know, being a savvy consumer is actually understanding that you are here tonight, you are doing that work already by showing up, but part of this is staying informed, really making educated decisions. So getting all the information you need from various different sources to ensure that it's accurate information, setting boundaries when needed with, you know, really clarifying expectations of what you need, what you might want, and also understanding the other, you know, person or the other perspective side and what their needs or wants are, or why they're approaching things and their, you know, through their lens, right? And really communicating those needs. At the end of the day, we will get better outcomes for our healthcare the more that we can communicate, you know, effectively around that. So those are some of the things that we're going to touch on tonight, and really sort of use this lens throughout around really being this like proactive, savvy consumer. So next slide, please. All right, so tonight we're going to actually talk through those wants, needs, and expectations. We'll look a little bit about what are some things you should think about when you're actually choosing a treatment product provider, as well as understanding the rules of engagement with manufacturers and specialty pharmacy, and then wrap up with some final thoughts and close out. So it's going to be pretty fun here tonight, hopefully. Keep it lively. Next slide. All right, so we definitely want to dive in a little bit to the nuance of wants, needs, and expectations. So you can go ahead and go to the next slide. This is another one now where we will invite you to join us in Mentimeter. So looks like we already might have some responses. I love this. Before I can even explain it, this is a proactive group. So I would love to hear from all of you when you are dealing with your healthcare provider or maybe your pharmacy where you get your bleeding disorder treatment products from. What are the things you want? And really, you can even type in want and then the word. You can write in more than one thing. You can add multiple times. And then sort of thinking about what are the things that you need and breaking it out into that. And we'll talk a little bit more about that, but from your own gut interpretation of what do you think your wants are versus your needs. So I'm seeing transparency as something that I'm guessing might be wanted or needed. Timeliness, absolutely. Responsiveness from that healthcare provider, pharmacy, clear communication, including me in the decision-making process. Yeah, absolutely. Wonderful. And I'll give others another minute here to continue to chime in or add anything else if you want to put whether it's a want or a need as you type it in. I was thinking of some examples as we were, you know, putting this whole thing together. Last week in the presentation, Dawn Rodolini, our Chief Operating Officer, gave the example of when she got her, she'd had to switch specialty pharmacy due to insurance and where they were living, and that was what was available. And the first shipment she got, rather than medical gloves, they shipped her cleaning gloves, like that you use to wash dishes or scrub your toilet, that are super bulky and not safe, the right thing. And so thinking of wants versus needs, right? That is actually something you need. You need the right medical equipment and supplies to be able to do your infusions, right? And what are the wants? We'd like that to arrive on time in a timely manner, all of those things. So it's kind of like breaking some of that apart. Or I really need to make sure that I have all of my Profi, product and supplies. So because I travel a lot for work and I need to ensure that I have it in advance of trips, so I can make sure I always have the right supplies with me. So really thinking through what that means for you. So want honest information and need access to that support. Great, thank you for sharing. Wonderful. So go ahead and go to the next slide, please. So obviously there can be a lot around wants and needs. And I think it sounds a little cheesy and basic, but frankly, sometimes we get so in the mix and we have so many real like thoughts, feelings, and emotions around our treatment and care, right? Some of this can truly be life-changing. So it can feel really like urgent for everything, especially if it might be some sort of crisis situation where it's like, I need this all right now, but it can be really helpful to take a step back and actually think about what are the things that I truly need? What are the basics, the non-negotiables, right? These are the things I truly need from these relationships, from these providers, from, specialty pharmacy or however you happen to be getting your treatment products. And then what are the things that are wants on top of that? Now, this is not to actually say that wants are something you shouldn't go for, right? But then it might be more about advocacy to get those wants, or working with insurance, working with NHF to help support you through working with your insurance company if you're having access issues, right? To really get at these things. And then sometimes it might mean that we have to take a step back and actually reflect, all right, what the options are that are offered to me is truly, I've done all the work, I've done a bunch of extra research and a bunch of extra advocacy, and these truly are the only options. It's not my ideal, but actually it's meeting my needs right now, right? So it might be, some of the examples I've heard over the years are, we have great pediatric hematology in our area, and then my child aged out, and I really, really want my kid to still be seen at the pediatric center because those hematologists are so great, and there really isn't through our insurance, it's not covered for adult hematology here, and they have to go really far away, and all these other challenges. So these are things that we, as a community, we want to support and address. But if you're still able to get your annual visit and you have good care and access to your treatment, it's good to then take a step back and be like, well, what of these wants now can I truly work on one thing at a time, right? So it's really kind of parsing that out. But the other thing to really think about is clearly communicating those wants and needs, what's realistic and achievable, right? Sort of, so the needs are the bottom line, but some of these wants we might need to tackle one first, then another. And also knowing the cans and cannots. And so that's a little bit of some of the stuff that we're going to get into here today, and trying to walk through some of the things we just need to know as background as we navigate some of these conversations. So the Office of the Inspector General, there's going to be more acronyms here tonight. So OIG, you'll see on a lot of our slides, actually does some of the regulation around the interactions between manufacturers or specialty pharmacy and the actual recipients of the medications. And so they have done this over many, many years now through these advisory opinions, which we will talk through some of those. So that's sort of helping us understand some of the nuances of navigating these relationships in the community. So next slide, please. So as we get into now choosing a treatment provider, we're going to talk a little bit about some of the things we need to think about when going down that path. So next slide. So a quick recap from last week, again, for those who weren't able to be on part one of our 4-part series, it will be up in the, shortly on NHF's website, and we'll let folks know when that does get up there. I highly recommend watching that on demand if you haven't been able to. But you can obviously get your actual treatment products for your bleeding disorder from various different places, right? So some people will get it through their 340B, which is part of their HTC. Some people might get it through specialty pharmacy. So those are things to understand as a basic, like what are my options for me? What's covered by my insurance, and really understanding some of that so you understand what your options are. And that was a lot of the details. We went way in more depth about all those players and what's offered at all of that last week. So again, if you're curious about any of that, we'll definitely have that link up soon so you can watch that recap. Next slide, please. So once you just, I think a lot of people are like, oh, my doctor, gave me a prescription and told me here's where I should fill it. I do not myself have a bleeding disorder, but I have had many conditions where I've needed to go through, a very specialized pharmacy, and they often are just like, here's the one to call. And in my mind, I'm like, my doctor told me this. I trust them. I'm just going to go with that. When I was like, wait, here's what I do know. I know that I actually might have more options than that. I can call them. Let me ask a ton of questions, make sure this is the right fit. Let me make sure it's actually covered by my insurance by going through here. And let me also ask my provider before I leave that virtual call or in-person visit, is this the only place that I can actually fulfill this? Like, what else do I need to know? What are my options? We often have more options than we realize, not always, but it's always good to start there and ask. So when you actually are at the place where you can dive into some of those questions. We have a really good list here, and I'll touch on a few of them about questions to ask or things you should think about when choosing where to get your treatment from. So we already mentioned, you know, are you a preferred provider under my insurance plan? You know, I will say some of these things might take calls to your insurance, not just to, you know, the actual pharmacy or whoever would be fulfilling the prescription. It might take a little bit of legwork. You might not get an answer right away. It might be that somebody has to look into some of this and get back to you. What about copay and deductible costs? Truly understanding the scope of the costs and when. Is it going to be a larger payment at the beginning of the year because you have high deductible? You know, what does all of that look like? Do you have any financial assistance? Those are critical things to really making sure that you're able to afford your care. Simple things like hours of operation. If I have an issue, right? Bleeds don't know what day of the week it is. And if you have a bleed on the weekend or need some emergency supplies or whatever it may be, is there going to be somebody who can pick up the phone, right? What are some of those options that you have? What is the standard delivery time, ensuring that things will be there when you need them? Can they even take emergency orders? Should that come up? Sort of gave an example of that already. This number 6, I think, is really timely. Do you have an emergency plan in place in event of a natural disaster or other emergency? And unfortunately, we have seen a lot of those in the United States over this past year, over the past few years, really hit our community. And, you know, chapters and HTCs mobilizing around hurricanes, wildfires, or whatever it may be. But truly having that emergency plan in place is really important to think about from the start, right? And how would you navigate that to ensure that you have adequate access to your factor or whatever treatment you may have. Similar things, what will be the ancillaries that will come with my order? Do you have adequate supply of the product that I actually need and the dosage that I require? So knowing your dose, knowing your actual product name, all of those things. There's no silly question to ask your healthcare provider to make sure you have all the tools, you have all the information you need to be able to ask these questions of the venue that you'll be getting your medicine from. And then similar, if there's other additional services that are provided by, say, a specialty pharmacy, you know, is there a cost for these? Are all of them free? What's included? And how can I understand what's going on here? Is it nursing, physical therapy, in-home, education? Like, what are those other things? So I will say I actually appreciate some of these ones at the very end. We don't always read to the ones all the way at the end because it gets long, right? But things like, will I receive copies of all billing invoices? These things matter these days. I had a day off on Friday and I spent half of it trying to track down itemized bills for my healthcare provider because I was out of network, and that was a choice I made to see a provider out of network, knowing that I'd have to go through more paperwork, go through potentially higher out-of-pocket costs to hopefully get reimbursed later. But then I needed to make sure the invoice, they said, yes, of course we'll send you receipts, but I didn't think at the front to ask about itemized. So it was just all of those steps that might take a while longer to make sure we can properly submit things. So all of those things really matter. And then do you participate in a patient notification system for product recalls, right? And anything you would need to know if there's something about your product that comes up, will your actual pharmacy provider be able to communicate about that in a timely manner? Great. If anybody has any other questions that they really like to ask or have asked that have been really useful in the past, I see we have a lot going on in the chat. Please either unmute yourself or go ahead and throw it into the chat. All right. Great. I think that's that. I don't see anything else. Oh, wait, I like to ask, what if I need to get out of the automated system and speak to someone? You know, we used to always just be able to press 0 and like bypass all of that and get right to a human. But you're not wrong. Thank you for sharing that. Sometimes it can take a minute to actually get to a human. And I will say, you know, anytime that you have to navigate new insurance, new healthcare provider, new pharmacy provider, anything like that. Trying to go in at a time of, mental patience and just knowing that it might take a little bit can be really helpful to ensure that you can get through whatever that system may be. Or as I have found recently, I'll do like the chat on the app if they have some sort of app, especially with my insurance company. I'll be doing a live chat and on the 800 number, trying to see whoever picks up first and responds, I'm going to go with that. So it can definitely take some navigation. And I will say, just as in terms of the patients as well, there's some of these questions that, you might not get an answer right away or at all, right? And you need to ask when you'd follow up, or who else would I need to talk to for some of this kind of information. But best to know you have a good list to ask about. Great. All right, let's go on to the next slide. So one of the examples in there was around product recalls. And so we wanted to give a current day example of this. So back in early or sort of mid 2020, it wasn't exactly a recall, but the production manufacturer, Ferring Pharmaceuticals, ended their contract with CSL, who produces Stimate. And so it was a real challenge. It wasn't that people didn't still need Stimate or that there was something wrong with it. All of a sudden there was like a disconnect in how can we get it produced and out to the community who needs this. And so that actually has taken some time, lots of advocacy by many national partners in this. NHF has worked very closely with HFA and the Hemophilia Alliance, who actually put together some of these slides here, but to really advocate and figure out, all right, if there isn't sort of a national system right away, what can we do on a state-by-state basis? So through some of those partnerships. Now there is, you can see here in green that Stimate is now available in these states again through a new partnership, and had to go though, like this is all the background behind the scenes, really apply for a license in each state. So it couldn't just be like, hey, this is going to be available everywhere. So I've had to go back. I won't get into the details on the why and some of the language behind that. If anybody's curious though, I am happy to share some of this and connect you with our policy and advocacy team. And we do have a couple of news articles on NHF's website about this as well. But this is the kind of thing. So, hey, all of a sudden, I think I have good access to my, treatment product, and now it's not available, not because my insurance isn't covering it, but because of production issues, right? And not being able to get it out to folks. But it is actually still under review in many more states, and they are hopeful that it will be much more widely available soon. So, thank you. So now we're going to move on to our next section, really about understanding some of the rules of engagement. We mentioned some of the questions to ask, but really getting into what else do I need to know about navigating these relationships with specialty pharmacy or manufacturers. So next slide. So this is where we get into some of that stuff I mentioned earlier about OIG and what sort of their laws around a lot of this, regulating the interactions between manufacturers, pharmaceutical companies, specialty pharmacy, actually both with patients, but also with healthcare providers. We're not going to get so much into the healthcare providers side of that tonight, because this is really for a consumer audience. But there is a lot of regulation that all of us, now are protected by, right? But it's good to sort of know what are some of those rules and regs as we navigate these relationships. So manufacturers cannot give items or support of any monetary nature directly to patients or potential patients. And we'll get into some nuances of that in a minute. These laws also regulate how industry interacts with doctors, nurses, and social workers, as I mentioned. And on the education side of that, we experience that a lot. Just so folks know, these laws are very much in action and are here, everybody does take them seriously. We have to report out when we use our amazing Speakers Bureau of healthcare providers that are experts in the field. If we as NHF had gotten certain types of donations from manufacturers to our programs, like not to the individuals, but just to NHF to run these programs. For some, we still have to do that reporting to ensure that it's all very transparent, right? All very clear about if any healthcare providers may have gotten funding through something like this. So, it is, all of this is taken very seriously. And then regulations are issued at both the federal and state level. And so there's a lot of guidelines out there, even beyond the federal law, where industries regulate themselves. And so pharma is one of the examples of associations, essentially, that come together and set their own industry standards to live up to as well. So that's sort of the background of it. Next slide, please. So some examples, to make this all more concrete, and because hemophilia was actually listed in some of these older advisories, but really was around gifts and what are called inducements, but really any sort of money or funding directly to families, directly to patients and their families. And so some of this started long time ago and might feel out of date, but it's actually still relevant today to know that these are some of the protections in place and where there might be a gray line. So back in August in 2002, the OIG issued a special advisory bulletin on offering gifts and other inducements to beneficiaries, and then an additional one on the provision of certain free goods to individuals with hemophilia. So if you go to the next slide. So why did all of this come up? I have only worked at NHF for 6 years. I'd actually been doing some work in the community before that. But, I'd heard some of these stories, the folklore of, many years ago of that person got a pool put in their yard or, sent off to college, scholarships, all of these things, right? So as all of these new rules were being put into place to really regulate those interactions, people were trying, and our partners were trying to understand this and ensure that they were following the rules. So in some of these examples, actually in this one that we'll talk about here, a specialty pharmacy actually reached out to OIG to get some clarification, right? Like, this rule is still unclear. We really want to make sure we're following it. So this is really to give healthcare providers and suppliers a better understanding of the provisions of this anti-beneficiary inducement regulation, aka giving out the gifts, right? And there's some clarification. So I understand maybe I can't give money or put that pool in the backyard, but what about safety items that are needed for your bleeding disorder, like helmets, knee pads, medical bracelets? And you can see how old this is, because look, yes, it said pagers because it was from 2002. So it is definitely a little dated. That's not as relevant, but really to understand if medical supplies are part of that, like what is included and what isn't. And so if I'm happy to throw this into, for those who like a little history here, into the chat, you can go and actually read some of those old advisories. So it's really interesting to me, right? And so there was clarification on that. You can go ahead to the next slide. So let's start to dive into some of this. Knowing what I've already sort of shared so far, can a specialty pharmacy or manufacturer provide items to patients and caregivers for free? What do you think they said out of that advisory? What's your guess? Yes, no, depends, or do I have time to Google the answer? All right, we got one answer in. We'll give it a minute as we wait for others. 2 depends. Good. 1 no. One more minute. All right. So thank you for participating. 3 depends, 1 no, 4 depends. So, I mean, it just goes to show how, the murkiness, like if it depends, is it no? There's still a lot of questions out here. And these were some things that were, theoretically clarified to the community, almost 20 years ago. So you can go ahead to the next slide. Thank you. So it is a little complicated. Well, they actually put in a monetary amount. And just as recently as I believe it was like 2016, 2019, they actually increased that amount. So originally it was you can give items out that are nominal value. So if the knee pads were only $10, that I think that was one of the examples, that then, hey, that could be the thing that could be given out. On an individual basis, those limits of nominal value are set at $15 now per individual item, and no more than 75 worth of those items per individual per year. And so it's hard sometimes as a patient or community member to know. We go to lots of events and there's all these freebies and like sort of keeping an eye on what's coming in from where. It's just good to understand some of this, right? And understand, what the role might be. So that is a piece of it, right? So it is okay, but up to a certain amount for any individual item, and then up to an even higher amount for sort of like cumulative across the year. So something like a pager back in 2002 probably would not have been okay. I don't remember exactly how much they cost back then, but I would imagine it was more than $15. So this is the current amounts. And again, if anybody is curious, it was 2016 that it was updated. For any of those documents, I threw those in as well into the chat. Great, next slide. So here's another version of that. Can my specialty pharmacy or manufacturer pay for me or my family to attend regional, like my chapter events, or national meetings maybe, such as NHF's Bleeding Disorders Conference or HFA Symposium? Is that okay? No, it depends. All right, we got some, and I have no idea. Thank you for the honor. We were talking about honesty and transparency. I must admit, I had to learn all this, right? I mean, these are things that aren't always clarified, super clearly. So it's okay to not know. That's why we're all here together today. So great, thank you all. We got a little no, some depends, some I have no idea. So you can go ahead to the next slide. And as you can imagine, this one is no, right? So really mostly because that you would quickly go over that $15 amount or $75 cumulative per year per person, right? To travel to most things these days, there's a pretty high cost to it. I will say that is why our chapters and NHF and HFA, we partner with our, industry sponsors and really make it a partnership. So educational programs can come together still, and we can ensure access to information and education as a community. So there's other ways that these industry partners can truly do that, be a partner and ensure that the community has access to these things without individually being like, Bob from North Dakota is going to come to this, right? Without making those individual choices and decisions, where then it could be, perceived as an undue influence, right? And so this is why some of these national partnerships really can come into play to ensure that this information and education still is accessible. Great, thanks. Next slide, please. So here's another nuance. What about educational dinners? I've definitely been to an educational dinner sponsored by industry. What happens? How does that work, right? That's what I mean. There's a lot of these gray fine lines. So, the educational component of that is what's really important, right? And that the fact that it's offered with education, and education is really driving it, and there happen to be a little bit of food and refreshment, something moderate, then that's something that actually would still be perceived as okay by OIG. So if anything, at the end of the day, if anything feels a little off, if something feels too extravagant, or you're just unsure, it's okay to ask, right? Or it's okay to say, I'm going to think about it, whether attending, and I'll get back to you. If you've been invited to something that you're just not quite sure, that's where NHF, your local chapter, there's so many folks out there that could be really good resources, just to your HTC even, to like walk through, is this thing legit? Is it not? I want to make sure I'm doing this right? So there's a lot of resources there for you. Great, thank you. Next slide. So let's say I'm at an event. Do I have to sign my name and give my personal information when I attend that event? Right here, they're getting me dinner, or I'm getting some nice little like appetizers while we learn about joint health. What's my obligation as an attendee? All right, so we're getting some no and some attend, some depends, sorry. All right, so you can go ahead to the next slide. So, technically it's your personal information, right? So I really appreciate people thinking through this one. So no, you don't have to give your information. You don't have to give your contact information, your phone number, your email, any of that. However, I do think it's really important to think about some of these things as partnerships, right? And so put yourself in their shoes. People, some industry or specialty pharmacy, somebody's hosting an educational dinner. They have maybe like a nurse trained educator who's coming out and really sharing about whatever the topic may be. And from their minds, they have to show and reconcile receipts. Hey, we had this appetizers for 10 people, and look, 10 people actually showed up, right? So there's some accountability that they have on their own end, as well as just being good partners and showing like how many people are there, how did it go, all of those things. So they might be required to collect attendee information, but it's the what information that is also truly up to you. So, the purpose is often to educate and market their products and services, right? And so they do need to track some of these things around spending per person to be in compliance on their end. So good things to think about, right? But you have options. You can sign up and actually give your information and your email. I think, manufacturers have a ton of information about their products and all of the latest research and all of that. So it's not a bad thing. If you want more information direct from that source, absolutely sign up, but know that you're going to get follow-up emails, right? They'll call, maybe they'll, if you put down your mailing address, you'll get the snail mail, old school. So don't be surprised then when some of that stuff comes in. But if you want that can be a great way to get information about what's out there in the community. You can also ask the representative, whoever is there managing the event, how to sign in without sharing your personal information. I want to make sure you get credit for tonight. I know you guys have worked so hard. Thank you. I've learned so much. I'm a little uncomfortable leaving my email address. Is there another way I can make sure that you still get what you need, but I don't have to leave my email address, right? Have that conversation, right? And I think, that's perfectly okay. And usually people will be able to figure out a way that it can be a win-win for everybody and still get the information that everyone needs. Great. Next slide, please. And I see there was a request to post the second OIG link. At the end of this, I'll have to recopy it, but I'll throw it in there to make sure it's actually clickable. So sorry about that. All right, so a few other questions around all this guidance, right? So what are the actual consequences, right? If somebody actually breaks the law, especially pharmacy and manufacturer, actual patient consumer, what happens? So there are many different options of what could potentially happen, including like pretty significant monetary fines per violation. And we used to have a number in here. As I was updating these slides, whenever I do this, I want to make sure in case the laws have changed to get the latest. And what I sort of saw this most recent round was that it is often the reason why it says per violation, because it might include, if there was some violation, paying back some amount plus a fine on top of that. So, but there can be actual financial implications of this for the specialty pharmacy provider, supplier, or manufacturer. And if it's determined that the anti-kickback statute was involved, which means that, hey, I as a patient was actually part of this and knowingly was part of either some sort of like insurance fraud, or I got some cut by maybe falsifying some of my records or my logs, my bleed logs, whatever it may be, or my factor, treatment logs, that those can actually be applied to the individuals as well. And it might exclude you from your healthcare provider, from your insurance provider, if you're on Medicare or Medicaid, right? There's also been criminal sanctions, including jail time, right? So it can get serious. And unfortunately, there's examples of that in this community. So it is worthwhile understanding these rules and knowing how to navigate them. And the example that, that I had seen within the hemophilia community was specifically around sort of falsifying records, around treatment logs, and all parties, the patient as well as the specialty pharmacy in this case, all had fines and jail time. It was a serious case. So great, next slide, please. The other one, and before I jump into this, the other one that people often, and again, this is just what, like, it's important to know the rules. It's important to know around your insurance. And when something's, prescribed just to you, that means you are the only person that can use that medicine, right? So I think out of some very goodwill of the community, there was lots of discussion years ago around, well, can I donate my unused factor to another country or to kids at camp, or through my camp, it'll go, to help these folks that don't have it. And so there are organizations that do that to make sure that it's done in the right way. And it is typically not through individuals who are donating their factor, because that was prescribed to you, right? And then that might be against the law, usually insurance issues there, right? Insurance fraud. So you just have to be really careful, and all good things and good intentions, but that's where you just got to ask those questions, right? And really make sure you're understanding the full implications of something that you might do. So does this law apply only to those on Medicare and Medicaid? And in most states, sorry, and it doesn't. So Medicare, Medicaid then being national, if I'm not on that, do not have to worry about these things. But it's actually that states also have their own anti-kickback laws that apply then to private insurance. So it really is the standard to just know about this. But yes, every state can have different nuances. As you can see here, as of December 2019, 39 states and DC have anti-kickback laws. And they usually apply to all payers. But if you're curious, you can, look into your own state's specifics. And if you do have specific questions about your state, you're always welcome to reach out to NHF. I think contacting Handy at hemophilia.org is always the best route. And then they'll get that directed probably to our policy and advocacy team that can give you access to resources specific to your state. Great, next slide, please. So that's a lot, right? That's like a lot of information. What do you do with all of that, right? It can feel overwhelming, but truly having the information is better than stumbling into something and not even realizing it, right? So you're here tonight. You're already being, getting the information that you need. But there can still, because even as I mentioned, some of this, it's like, oh, is that a gray line? What about this? What about this? There's probably 12 more examples everyone could ask that could need clarification. So ask those questions, your chapters, your HTC, so many people can be really good points of reference for, is this okay or is it not? So do reach out to those resources. Industry representatives themselves are also valuable resources, right? For all of, some really good information about their products. But as you go into those interactions, ensure that you know the do's and don'ts, right? And communicate your expectations. And then again, just remember, it's okay to do in a perfectly lovely, pleasant way. Just be like, thank you for that. I'm going to have to get back to you on whether I can participate in that, or I have some questions. Let me get back to you, right? And there's ways to do it where you can still ensure that you're getting, if you're unsure if something's okay or not, you can get the information you need and still be, like a good partner in the community. You are truly your best advocate. So always know that, and always know that you have resources here at NHF. So there's a question in the grant about providing fake names at educational dinners. So I don't think it's so much about providing fake names. I mean, I'm sure people do various things. I do think, again, it's about being good partners. And so it might be, I would recommend talking to whoever the host is of that event, right? The representative there or digitally, and just sharing your concerns. And it might just be like, oh, you can just put your initials. I mean, they might have some other solution that feels okay to you as well. And so I think it's more about the conversation around it that can be helpful. Great question. All right, so next slide is any other questions. Thank you all for the activity in the chat and in Mentimeter. If there are further questions, now is a great time. I will also go ahead and put in the chat Handy at hemophilia.org, which is a great place to email if you want further information. We can make sure that gets directed to the right folks at NHF.
It's also a great comment from Grant that he made. Thank you so much for sharing this. Where he said, first name and last initial should be acceptable for most educational programs, but ask the host and partner. So he's underlying what you have said before.
Yeah, great. Thank you for that.